When we do a CT scan of all those patients, in a majority of the patients, we found a small cavity in the bone with a history of a wisdom tooth extraction a long time ago. The idea of this video is to clarify some of the questions and answer some topics related with cavitations. A cavitation is a cavity inside the bone. Basically, it's a socket after an extraction that did not heal completely. Every time you receive a wisdom tooth extraction, the body itself heals, and that's normal, right? There is a healing process that starts from the top of the bone to the inner part. But if we don't remove the connection that we have between the tooth and the bone, that is the periodontal ligament, pretty much that healing process encapsulates the whole periodontal content. And what happens in the bone once we have a cavitation? Pretty much what happens is that the bone itself tries to react or try to protect the body, isolating that cavity. So pretty much what we see in the bone itself is a hole where the cavity is and a layer of bone around that area. That layer of bone is created in order to try to isolate the problem. The cavitation is there, the body is trying to isolate that problem, and pretty much the immune system is triggered, is always on. So you never get like real resting during the healing process. And of course, there are so many things that after a long time shows up, like autoimmune diseases. The difficulty about the cavitation is that the symptoms are not all the time related with the problem. Pretty much are like a more general issues. The theory says that are related because the immune system is aware of trying to fight against the subclinical entity that we have in the bone. And of course, the immune system get like crazy once they fight for a lot of years. This is a long-term problem. It's not like a real immediate problem. That's why the patient lost the connection. They lost the connection between the wisdom tooth extraction that was done like 20 years ago and the autoimmune problems that they have right now. In our practice, in order to make a decision if a patient have a cavitation that could be treated, we follow in our protocol 5 steps as a part of every single extraction. The first step is based on an atraumatical extraction, means trying to do the extraction without affecting the bone. We remove all the periodontal tissue, and we also remove a little bit of the bone around the teeth or the surface of a tooth. Once we do that, we use the ozone to clean the surface of the bone. Then we fill the hole, and that's the most important part. We need to fill the void space, otherwise the body itself are gonna heal around the hole. And sometimes the body is not good enough to close that cavitation in the middle. So we need to use a bone substitute mixed up with PRF, plated rich fiber from a patient. And then once we have that sticky structure, we fill inside the socket, and then we need to close completely that structure. This is the typical patient. It's a very healthy patient, pretty much well controlled with supplementation. They're very healthy in general, but they still have an issue. They still have an issue and a missing link. When we do a CT scan of all those patients, in a majority of the patients, we found a small cavity in the bone with a history of a wisdom tooth extraction a long time ago. What should I expect after a cavitation surgery? Part of what is going to happen is that the patient is going to have a small swelling related with the cavitation areas, but pretty much most of the time we do minimally invasive with a minimal incision. We prep the patient before the surgery. That includes micronutrients, macronutrients, some antioxidants in order to reduce the oxidation in surgery. Helotherm mask, that is a mask that helps us with the inflammation. And we also give hyperbaric chamber to our patients. Of course, the 2 first weeks are related with the healing process locally in the area. But after that healing process, the patients start like thinking very clear. That brain fog disappears, a little bit more sharp. If you have a wisdom tooth extracted, and you feel that you have a cavitation because you have any kind of symptom, go to your biological dentist and have a CT scan. If you have a question, please contact us and let us be part of your healing process.